Okay, hello and welcome to this OET Introduction class. In this class, we're going to talk about introduction paragraphs for OET writing. And I'm here in the class with quite a number of people, including Neshka and Han and Isabel and Eugenia. Guys, can you just all say hello as usual?
Hello.
Hello.
Hi.
Hello. Okay, and as usual, I need to confirm that you can see my Word document. So maybe Sabrina, if you could put your microphone on and just tell me, can you see that clearly?
Yes.
Okay, fantastic. So the plan for today is not 1, 2, 4, 1, 2, 3, is we're going to first review the format of the test. It's an introduction class. Then we're going to talk a little bit about letter types. All right. Then I will teach you how to write an introduction. Sentence 1 and sentence 2. Okay. This we'll be using mainly discharge letters for this, but I will be giving you variations for the other letter types as well. Okay. At the end of the class, hopefully you can ask me some questions about things. So let's get started. And I'll ask Sabrina again. We're going to do a review, Sabrina. So the format of the test, how much time do you have in the OET writing? How much time in total?
OET writing, 5 minutes preparation time. That time we will not able to write anything.
So 5 minutes to read
And
only.
then 40 minutes.
Yeah. So 5 minutes to read only.
Only.
You cannot write. And then writing time?
Yeah, and 40 minutes. 40 minutes.
40 minutes writing time. Fantastic. Okay, so 5 minutes to read only. You have to put your pens down in this stage. Okay, so is there anything else about the OET writing exam we should know in terms of basic format? Does anyone want to remind us of anything? You can't wear watches, of course, in the exam. What else?
It's profession specific, so you have a task for doctors and task for nurses. And
yep, profession specific. That's good. That reminds me, though, it's profession specific, but the OET writing criteria
are the same.
Are all the same. So that's good for teachers like me. I don't have to learn like doctors' criteria, nurses, physio criteria. I just learn one criteria. Okay, that's good. So this is basically what you're dealing with. You got 45 minutes in total, 5 minutes to read with pens down, 40 minutes of writing time. It's profession specific. Let's talk a little bit about letter types though. So Sailesh, are you there?
Yes.
Letter types. When we study IELTS, we talk about essay types, don't we? But there are letter types in OET. What are they?
So it can be either referral letters or discharge letters.
There's referral to what?
Referral to a specialist or to a
specialist. Good.
Occupational therapist, some other.
Good. You're a little bit quiet, Sailesh. I'm sorry. So I'm just going to move on to someone else. Isabel, are you there?
Yes.
So we've got referral to a specialist. What else have we got?
Discharge.
Discharge. Good. Anything else?
And transfer letter.
Transfer. Okay. Now these are the three main types. That's not to say there aren't more types than these.
Update letter as well.
Yeah, well, there are different types, but I always like to stick with the basics. Okay, so for example, guys, if we look at this here, this is the OET official website, right? And I'm writing a book on OET writing. So when I was writing my book, I researched this. And if we read what they say here, they say, the task is to write a letter, usually a referral letter. That's interesting. Now, I think for nurses, it's not usually a referral letter. What is it usually for nurses?
Transfer.
Discharge.
Discharge. It used to be mostly discharges, but they've changed it now, so they have all of them. I guess for doctors, you often write a referral letter, don't you, doctors?
Yes.
99% of the time, okay? So that's the usual letter type, referral to a specialist. Some alternative letter types are a letter of transfer and a letter of discharge, okay? So on the OET website itself, it singles those three out as being the main ones. All this stuff here is about different professions, okay? So we need to focus on those main three, especially for an introduction class. And then later on, we see the variations, right? Don't start with the variations, start with the basics. So these are the 3 letter types. Let's get a quick definition about these though. So maybe Susmita, I don't know if you're there, or Eugenia, are you there?
Yeah.
Okay, so what's a discharge letter? What's the basic situation? A patient is what?
Discharged from hospital.
Leaving the hospital, good. Being discharged, yep. And
And
you are writing what? Who could you write to? Could be a nurse.
GB,
Yeah.
GB.
Could be a
GP.
GP or a nurse or physio. Could be many things. Yeah. To a person who will, who will do something next. Let's say.
Ongoing care.
Yeah. Usually it's something like ongoing care, isn't it? You nurses, right? Usually it's ongoing care and support. You doctors, it's not usually that, is it? What is it?
No, further
usually
management or
Further
support.
management, treatment, yeah, that kind of thing. Okay. So usually ongoing care and support for nurses, I'll just put N here, or further management.
Follow-up care.
Management and care, something like that. So that gives us a rough idea of what a discharge letter is. What about a referral to a specialist? Let me ask this question now to Mariam. If you could just tell us quickly, what's a referral to a specialist and what do we do?
We refer a patient from a GP.
Yes, usually this is very common in doctors, as we said, but
Yeah.
you refer the patient to who?
To,
Very, very simple.
to specialized patient, doctor, I mean, it could be oncologist, could be anything like.
Yeah, I'll say a person with
higher
special knowledge.
degree.
Yeah. Higher what?
Higher degree than me.
Yeah. You could be a physio, though.
Yeah,
Right.
maybe.
Not a doctor, necessarily.
Could be occupational therapist.
Yeah, occupational therapist. We've seen one of those, haven't we? So yeah. But in general, you're referring the patient to a person with special knowledge, and you're usually asking them to do something next. What are you asking them to do?
Further management, maybe could be.
It can be management, but it's usually
Investigations.
assessment. Yeah,
Yeah,
investigation or
assessment
evaluation.
management.
Or definitive diagnosis.
It can be definitive diagnosis. It could be management. It could even be treatment. But usually, a specialist has special knowledge. So usually, they're assessing. Usually, but not always, as I said before. Transfer letter, Han. We're just talking in general now. What usually happens in a transfer letter?
This is for patient to continue service.
Yeah, continuing, isn't there?
Maybe like rehabilitation.
Let's just say there, rehab or treatment. Yeah, sorry, I can never type and talk. Rehab and treatment, something like that.
Yeah.
And then what happens? So they're moving from what?
One facility to another facility.
So in a new place, right?
Yep.
A patient is continuing their rehab and treatment in a new place. So referral to a specialist is refer the patient to a person with special knowledge to do something next, usually assessment. These are just synonyms, guys. A discharge is when a patient is leaving the hospital, or I should say the medical facility. It could be something else, right? And you write it to a person who's going to do something next, usually ongoing care and support for nurses. If you're a doctor, it's going to be further management, probably. Okay. Obviously, you got to read the case notes. I'm just talking in general. Okay. You've got to read the case notes. Lastly, transfer letter. Patient is moving from one place to another place, right? There's usually no problem specifically, you know? In a discharge letter, there's usually a problem. There's a reason why they went into the hospital. But often in a transfer letter, nothing has really changed. It's just that they're moving location. Okay? So these are the 3 types. And the reason I'm reviewing this, okay, the reason I'm reviewing this as part of OET is because it affects your introduction, doesn't it? The type of
Yes.
introduction you write will change depending on the letter type. Okay. Now I'm gonna focus, as I said at the start of class, on this type today, but we will talk about all types in the class. Okay, but I'm going to start off with discharge because it's the easiest. Okay, so let's begin with a discharge introduction paragraphs. Okay, so introduction paragraphs for discharge letters. What makes a good introduction paragraph? Let me ask this question to Karen. What makes a good introduction paragraph?
If it's composed with who you are writing and where are the house and why are you why the reason for the admission and the purpose.
Purpose is very, very important. We're going to see that in a second, Karen. I like that. Purpose is really, really important. What makes a good introduction paragraph? I'll just ask quickly one more person. Karen, I love that. Let me ask Siraj, because he's typed on the chat box. What makes a good introduction paragraph?
Yes. What makes good for you as a exam taker? It must be fast and informative for the reader.
Informative, fast. I like that. Informative, like they get some information.
Yeah.
Do we want lots of information?
No. Specific information, yeah.
Yeah. Because, for example, guys, let's look at this introduction. Let's look at this introduction here. Is this a good introduction, everyone?
Yeah.
That's a good intro, really?
No, not really. No.
It's like a joke. I'm writing regarding Mr. Jones, who was admitted to our hospital on January the 9th, suffering from multiple fractures on his left tibia as well as ligament tearing on his left ankle, due to which his pain was very severe indeed. Please note that he has blah, 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 blah. I'm going to stop.
Good writing, but not introduction.
What's the problem? Yeah, tell me, sir. The problem is?
I think it's very long.
It's very long. There's too much what?
Too much information.
Too much information, right? So one of the first things I'll say to you about introductions is you don't need too many details in the introduction. Okay? Otherwise, I mean, why is it? Let's think specifically about why this is bad. Yes, it's silly, but why is it bad? What am I not getting? If you put
the
too much,
purpose. The main
purpose. I don't get the purpose. Why is this guy writing? I'm not really sure. It's not that clear, is it? Okay. Why is that important? Why is the purpose important here for introductions? Anyone?
To clarify what he has to do next.
Okay, those are all good answers, but let me give you an even more specific answer. Okay, this is the OET writing criteria. What's the first criteria they're going to grade you on?
Purpose.
Right, and if you want to get a level 3, let's read it. Purpose of document is immediately apparent. What does that mean, immediately apparent?
You need to show
obvious.
Obvious, yeah.
And obvious, immediately, what do we mean? What does immediately mean here?
It has to be at the beginning.
It to be the beginning, right?
At once you read it.
Exactly.
So once you read it, you got the purpose.
Exactly. So if we put too much detail in our introduction, if we are not accurate in our introduction, if we make a mistake or something, we lose on the first category here. And it's only out of 3. You can only get 1, 2, or 3 in purpose, right? The rest of the categories are out of 7. So you have more of a chance to, make a mistake and you can go down a little bit. But in your introduction, if you make that mistake, you're already down to 2, maybe 1. Okay? So the key thing about introductions is the purpose must be clear. The purpose is not clear here. Why? There's too much information, right? What about this one? What do we think about this one here?
It's okay.
Perfect.
We're all happy with this? It should be okay. I tried to make a good one, and maybe I've made a mistake. I'm writing regarding Mr. Jones, who was admitted to our hospital recently due to a broken leg following a motorcycle accident. He is due to be discharged today and now requires your further care and support. Okay. This is the type of introduction I'm going to teach you today. It's got 2 sentences in, and there's a specific formula for doing it. Some of you will know this already. But I do want to say, if you have a different style of writing introductions, especially doctors, that's okay, right? I just have to choose one style. But if you have a slightly different way, that's fine. But you can just take any language today that you like, okay? Now, let's analyze this introduction. How many sentences are there, everyone?
2.
There are 2. And let me ask Daniela.
Mm-hmm.
What's the function of that bit there? What does that tell us?
You're introducing the patient.
Yeah, and this is what the previous person was talking about. I call this the who.
Who? Mm-hmm.
Yeah, so we're going to have a who in sentence 1. What's this next bit? Let me ask this question now to Alexandra. Are you there, Alexandra?
Yeah.
Who was admitted to our hospital recently?
Where?
This tells us where, doesn't it?
Yeah.
And it's in the hospital. Okay.
When?
And the last bit of this sentence 1, what's it telling us, guys?
Why?
Why?
I'm going to call this the why. Yeah, the why.
Yeah.
Okay. Notice that if you want, you can put in the word following. That tells us the cause, doesn't it? Cause of the problem. But the why is here. A broken leg. That's the why. Why did he go into hospital?
Because he has a broken leg.
Right. So in sentence 1, I think you need to answer those 3 questions if we want to have a clear purpose. Okay.
Hey, Alan, for you, is it important to put this is a transfer letter? This patient is being discharged today, or you don't need?
I think I tend to teach that, yeah, and we'll talk about that in a minute. Sentence 2, yeah, put the letter type in, right?
Okay.
And then tell them the purpose. This is the purpose. I'll show you that in a minute, guys. But this is the basic structure, guys, of sentence 1. I want to just ask you about due to here. What's the rule with due to?
It's a cause.
Because.
It's a cause, yeah.
Okay, but let me just ask this question now to Rijwana. Are you there, Rijwana?
Yeah.
Okay, so imagine in this case, I can say due to, right? But imagine it was like surgery or something. Can I say due to a surgery?
No.
Just surgery? No. Why not?
That would be after.
You can
I think you
language difference.
We use due
for
unexpected things.
Unexpected, yes. Unplanned things. Thank you, Neshka. And for planned.
Something planned.
Good. So microphones off, please. 1 second. So let's imagine then that this was not, I mean, no one plans a broken leg, do they? Right? But let's imagine instead that it was hip surgery. Let me ask this question to Han. If this was hip surgery, what would your first sentence be?
Plan.
If it was planned, so you say, I'm right regarding Mr. Jones, how would you, can you finish that sentence?
I'm writing regarding Mr. Jones, who was admitted to our hospital recently for his hip surgery. Yeah.
Good. And then we wouldn't say the motorcycle thing, yeah? Okay. So this is the first thing that we need to remember, that if it's planned or unplanned, you can use due to or for here. Okay? And as I said before, we use the word following as well, don't we? What is following telling me? This is a question for, who have I not asked? Allah. Are you there, Allah? Could you put your microphone on, Allah? No? Karen?
Following is probably the cause of the procedure, or
it gives us the cause of the medical problem. Now, do we always have this in the case notes? Often this is not available, right? So you might not need to use that. Okay. So that's sentence one. Now I just want to say something else about the about different letter types. Okay, what type of letter is this? Let me ask that question to, is it Relcha? Sorry for getting your name wrong. Who's that name I wrote down? Hiding from me. Sorry, Rekha.
Yes, sir.
Sorry, I'm saying your name wrong.
No, it's okay.
So in this case, it's what type of letter is it?
It is discharge.
Okay, but let's imagine that it's a different situation. Okay, let's imagine they didn't go into the hospital. Instead, they went into the clinic to see a GP.
Yeah.
What would you write here?
I will refer this patient to hospital.
Yeah, but you could say I'm writing regarding Mr. Jones. That's okay. Yeah. Then you can say who
was diagnosed with something.
Well, I want the where.
Who presented.
Who attended?
Who presented.
Yeah.
Came to my clinic with such problems.
You can say presented. We tend to present to clinics because we walk in ourselves. Yeah. Or you can say who visited.
Yeah.
Who attended.
Or who attended. Yeah. Who attended my clinic recently or our clinic recently. Right?
Yeah.
That's okay, isn't it? It's not too difficult to remember. No. Don't forget though that was admitted. Is that the passive or active?
No, it's
passive.
This one is passive, isn't it? Was admitted. Yeah. But these ones, are they passive?
No.
Simple past.
No, simple past.
And there's a good reason for this. To be admitted to hospital, we usually think of someone, you know, like being carried into the hospital, maybe on a stretcher. Ambulance are lifting them in. So you don't do it yourself.
No.
Okay.
Somebody else.
If I walked into a hospital and I said, "Excuse me, I'm very sick," in a hospital, what should we say, guys?
He's admitted.
Yeah, presented. We could say presented if I walked in. Okay. Here's another problem we often get with this part of where, though. There's another big problem. Let me ask this question to Festos if he's here, or Sithya. Are you there?
Yes.
Yeah? Okay, let's imagine now that it's a clinic, okay? But he didn't go in one time. He's been visiting the clinic many times, maybe 10 times in 3 months.
Okay.
What are you going to say for that? Clinic 10 times 10 over, let's say, 3 months. What would you say?
Over.
Who? No? Does anyone want to help her out? Who?
Over
has
the last
been
3 months.
Has been attending.
Yeah, Mr. John has been
Can I ask one question in this part?
On.
If you're writing a referral letter to a specialist, do we need to mention this? Or just we can say, I'm writing regarding Mr. Jones who, I don't know, has symptoms suggestive.
Now,
blah,
this
blah,
is what
blah.
I was saying at the start. Like, some of you doctors will have a slightly different way of doing this. And if you want to do it with symptoms suggestive of,
Because
that's okay.
of course, if we are writing a discharge, we need to say that this person was admitted. But if this person just visit us.
Let's do the variation. What would you say? Who?
Could be who has been recently diagnosed with pneumonia.
Yeah, you could say that, right? I'm happy for you to say that. These are variations, guys, right, of my pattern. So you're welcome to do that. Often doctors say with symptoms suggestive of.
So symptoms suggestive of, yeah.
So who has symptoms suggestive of.
Or who has been experiencing symptoms suggestive.
You don't experience symptoms suggestive of, I don't think. But yeah, you get the idea. These are variations without the where, aren't they?
Okay, perfect.
Without
Thank
the
you.
where. It's a great question. And as I said at the start, that's great. If you want to do it like that, that's fine. Okay. Best thing though is to learn the simple ways and then build up complexity later. Yeah. So here's some nice variations. I'll leave them on the screen. This is your sentence 1, okay? Not that hard. We don't want to put too many details in, okay? One final thing before I move on. Imagine it's a surgery, okay? And it's a right total left knee replacement surgery. Han, do I need to put all that in the introduction? Right total left knee.
No.
It's going to be a right, left.
Toe.
You can get rid of it, can't you? You can simplify the condition, can't you?
Yeah.
So right total left knee surgery can be what?
Total
knee replacement, also total knee surgery.
Knee surgery.
Yeah. It's okay to simplify in the introduction this, just a little bit, and then later on in your letter you can put all the details in.
Okay, that's fine.
Does that make sense?
Yes.
And the reason, why am I telling you to do that? There's a good reason. Why is it okay to simplify the condition here? If you
So
think
maybe
about,
it's clear for the reader if you just mention.
Yeah. Remember what we said before about purpose? It's got to be immediately clear, hasn't it?
Yeah.
I've read a lot of letters where people try to give too much detail about the condition, and then it's not immediately clear. And then I can't give you a 3, right? So that's just a little tip there. That's sentence 1, okay? We're going to do some practice now with sentence 1. Is everyone ready?
Yes.
So this should be quite fast. I'm going to show you some case notes. They're very simple. Find me the who. Find me the what? The where, and find me the
why.
Okay. Here are the case notes. Okay. Very famous set of case notes. Ramamurthy. That should be enough. This is enough. Just this. Who, where, why? Who can tell me?
Yes. Who is Ramamurthy?
It's Mr. Ramamurthy. That's the who.
Who?
Everyone?
Hospital. Where?
Mr. Ramamurthy is in hospital. Good. And why?
It's
Pneumonia.
Pneumonia. Do we know why? The cause of the pneumonia?
No.
Okay, so we're just going to write a very simple sentence now, guys. I'll give you 1 minute. No, you don't even need 1 minute. 30 seconds. And then I'll ask a random person to put on their microphone and just give me that sentence 1. Right? I'm writing regarding blah, 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 blah. So just have a think in your head now. What would you write here? Should be fairly easy, but anyone who's new might not be able to remember the previous screen. Just 5 more seconds. Okay, so if I ask Mukit, are you there, sir?
Yes, sir.
All right, so let's just do a quick example with this one. What would you write here?
I am writing regarding.
Make this a bit bigger. I'm writing regarding. Yep.
Mr. Ramamurthy.
Mr. Ramamurthy. I can never spell this guy's name. Ramamurthy. Yeah, there we go.
Who was admitted.
Yep, who was admitted.
In our hospital.
Yep.
Due to pneumonia.
We could say recently, yeah. Due to, is it due to or is it for?
Due to.
Yeah, due to
pneumonia.
Pneumonia, right? That's simple. That's clear. I'm happy with that. Let me test someone like Han. Han, let's imagine that now it's not, I'm just going to change something here, Han, okay? Let's imagine that he's been attending the clinic with flu 6 times. What would you say? He's got flu, it's a clinic, and he went 6 times in 1 month.
You mean 6 times in 1 month only with flu?
With only flu symptoms, yeah.
Okay. I'm writing regarding Mr. Ramamurthy, who has been visited our clinic.
Visiting
our clinic because of Pneumonia.
That's fine. That's good. That's good. Han, I'm happy with that. Anyone else want to try this one a bit more difficult? Maybe I'll ask Neshka.
Yeah.
So how would you say this one here? It's a bit different details.
I'm writing to refer Mr.
Ramamurthy,
who has been
how about this? Who has visited? Who has
visited our clinic recently?
You could say who has visited our clinic six
times recently, due to flu or for having flu or experiencing flu.
Yeah, due to having flu or due to experience. Yeah, I think having or just due to flu.
Can you say signs and symptoms suggestive of flu or
yeah? No, that would work. Signs and symptoms suggestive
of flu.
Severe flu or something. It's 6 times.
What about flu-like symptoms?
Flu. You could say due to flu-like symptoms. Yeah, I like that. Flu-like symptoms. Okay, good. So I just wanted to test you on that one because these are the tricky ones, aren't they? When there's more than one attendance. Okay, this one is good. I'm writing regarding Mr. Ramamurthy, who was admitted to a hospital recently due to pneumonia. I'm going to do one more. Okay.
Can I ask one thing here?
Yes.
So 6 times in 1 month. So we have to write who has visited or who has been visiting.
You can do both. That's why I was saying you can say who has been visiting, but don't put the times in. Yeah, it's a good question. Who has been visiting our clinic recently, right? Okay. You don't need to say how many times with this one.
Okay, thank you.
Okay, great question. Now, I'm going to do another one, but you're going to have less time. You're only going to have 15 seconds. Find me the who, find me the where, and find me the why. Are you all ready?
Yes.
Okay, let me just put this here 1 second for study document. Okay, here we go. Again, another very famous one.
Yeah.
Mr. Baker. But again, that's all you need to be able to write sentence 1. 10 seconds. Okay, so I'm going to ask someone to tell me, but if you want to type in the chat box, that's also okay. Susmita, are you there?
Yes.
Okay, what's the who? Just say the name. Gerald Baker, right? Hello,
yeah.
Susmita? Oh, we've lost her maybe. We've got the where, we've got the hospital. Let's try someone else quickly. Let me try Mariam.
Yes.
So where's who, where, and
it's Mr. Baker, and where is it's a hospital, and the diagnosis because it's left total knee replacement.
Good. Now remember what we said. Yeah. Remember what we said about simplifying this.
Yeah.
Yeah, because we don't want the readers to be confused at the start.
So, is it due to ongoing hypertension, high blood pressure?
Let's say this is just a total hip replacement, so it's planned.
It's 4.
So it's not. 4. It is not like following high blood pressure.
No, in this case, no. Okay. I'm pretty sure it's not. I think it's osteoarthritis, but it doesn't matter. Yeah. There is no cause. Okay. So can you tell me what do you need to write?
Yes. I'm writing regarding Mr. Baker.
Yeah.
Who?
What do I need? What do I need here? Everyone forget. Yep. Who?
Who was?
Yep.
Admitted our hospital.
Admitted our?
Our hospital.
Admitted. To. Don't forget. Yeah. Admitted to our hospital.
Our hospital.
Good.
Due to. No, it's 4.
4.
4. Total knee replacement.
You could say a total. That's clear. That's
total hip.
A total knee hip replacement. Sorry, yeah. Replacement. Good. All right. Does anyone else want to try this? Maybe Ridwana, if you're there, or Isabel, or Allah.
Yeah. So I'm writing to refer Mr. Baker. comma, who has been admitted to our hospital for total hip replacement surgery.
Oh, say that again. I'm writing to refer Mr. Baker, good, who has been referred, sorry, who has been admitted to our hospital.
Admitted to our hospital for total hip replacement.
Hip replacement. Okay. Yeah, as I say, you can have your own variations, okay?
The first one is who was admitted, no? Or who?
Yeah.
Who, yep, sorry, and I've made a mistake there. Thank you, Danielle. So who was admitted, it's passive voice, good. I think this one's okay. I wouldn't normally do this one, but it seems fine. It seems good to me. Be careful with the word refer, because sometimes people confuse that with specialist, right?
Okay.
But in this case, it's fine. There's no problem. You can't have this, though.
Can I give another one?
Why? Just one quick thing. Why can we not have this?
This is informal.
Technically informal, so we need I am. Good. And I wanted to challenge some of the more experienced people now. Let's say that instead of, I'll do another one with the present perfect problem, right? So he's been attending physio, right? For the last 6 months.
Has been attending?
Well, let's just test someone here. Sabrina, what would you say? Imagine that Mr. Baker is doing physio instead, and it was 6 months.
Mr. Baker has been attending physiotherapist.
Who? I'll do it my way, okay? Who has been attending?
Physiotherapist.
Imagine you're the physio.
Therapy.
To our clinic.
Okay.
What would you say? Our
rehab facility or
facility is always a very good word to use, actually, when you're not sure.
Facility.
Very general.
I'm not sure where it is. Yeah, for last 6 months. For the last 6 months. Yeah.
Okay, good. Little tip, guys. If you've used the word hospital too many times or used the word clinic too many times, you want a synonym. This is like a general term meaning, you know, it's a general medical place. Not even medical place, general official place, I guess. No, maybe it's medical facility. I'll say medical place. Okay, any questions about this? Say your name if that's okay. Any questions? Are we good with this?
Paul, sorry, Alan.
Yeah.
Can I say, can I give you a different sentence? Over last 6 months, Mr. Baker has been attending physiotherapy in our facilities.
In our facility, no plural.
Okay.
Yeah, you could use that sentence. That's what I mean. Definitely there's variations you can use. So long as that was accurate, that would be fine. Yeah. I'll just put this down as a variation.
Instead of using attending, so may I say who has been participating with our
when you start to get to physio, when you start to get to physio, you can start with saying has been, what did you say?
Participating.
Yeah, not with though, in.
In. Okay.
Yeah, that's good. Okay, so I'm going to move on to the second sentence now because I've spent a lot of time on this one. Okay.
No questions here.
Yes, go on.
Yeah. Could I say I'm writing to update you? I'm writing to refer you regarding the above patient without mention the name. The above patient.
Say that again. I'm writing to refer you.
The above patient.
The
above patient.
But in the introduction.
I mentioned before.
Yeah. I'm right. No, you can't. No, that's a good point. Very often people say, because remember, in your letter you say re, right? Right? Imagine this is me, okay? I'm not going to put my age. John Smith, aged 48, right? You can say, I am writing regarding the above mentioned, did you say? I would just use their name. You can't say patient as well. Did you know that? No patient. It's regarded as impersonal and not very nice. So you can't, okay? But I like using this phrase here, above mentioned. Also, aforementioned. Has anyone ever heard that term, aforementioned?
Yeah, but someone said it is own person.
Yeah. It's useful to use in your letters, but maybe not in your introductions. Okay, let's move on to sentence 2, okay? This is sentence 2. It's quite simple, shouldn't take too long. What have we got going on here? Let me ask this question to Neshka. Are you there, Neshka?
Yeah.
Let's analyze this. He is scheduled to be discharged today and now requires your further care and support.
It's mainly mentioned that given the letter type and the purpose.
Good, letter type and purpose here. So you've seen some of my stuff before. So let's analyze that then. He is scheduled to be discharged today.
He's being...
Yeah. Well, let's think about that in terms of letter types, guys. This is what I call the letter type part of the sentence. Okay. Let me just ask, for example, if I say, Eugenia, are you there?
Yes.
Imagine that this was not a discharge letter and instead a transfer letter. What would you say?
He's being transferred today.
Or whatever day it is, yeah? So he is being transferred today, you could say. What if it's next week?
Maybe he's being transferred to.
Will be transferred.
He will be.
You can just put the day here, next week. Right? Or
Will be transferred.
next Sunday. So you can say that. What if it's a referral to a specialist? He is... Anyone? Referral to a specialist.
Refers to you.
He's being referred to you. Yeah, because the person reading it is probably the specialist. He's being referred to you.
And requires ongoing, further investigation.
Well, let's think about this. This is part 1 is letter type. Part 2 is going to be
purpose.
Purpose. So Sabrina, are you there?
Yes.
Sabrina, just give us an indication of this one here. Further care and support, right? This is the purpose of the letter.
Okay, further care and support we can, like for doctors, we can get from GP. Exactly.
So for a doctor, you're never going to say that probably. So you're going to say,
like in doctor's letter, like we can request to GP for further care.
Further assessment.
Yeah. But if you're writing to a GP, you could say further assessment and treatment, maybe?
Or ongoing.
Normally further care, like for assessment and management, like we normally we refer to the specialist, isn't it?
There's loads of different types, right?
Yeah, depending upon the
exactly.
Letters. Yeah.
And what I will say to you guys is when I'm marking the letters, I'm looking to see if you use the same words as are in the case notes, right? Sometimes the case notes will say management, okay? And the person will write treatment. Please treat the person. Is that the same?
No,
No.
not fully.
The management include
management is a part of treatment is a part of management.
Exactly, but just take the words from the case notes, right? It's not IELTS. You don't have to use a synonym every time. Okay, so if they say treatment, you're going to say treatment.
Yes. Can I ask a small question?
Yes.
I need. It is right to say requires further care or requires assessment, or do I need to say your part?
It's not essential, no, but it's more natural sounding, I guess. But you don't need it. Yeah, you could put requires assessment and treatment.
Okay.
It's okay. That's a good question. It's optional. But there are different things we can say. Let's think of this in terms of letter types. Okay, so if I'm writing a discharge, I might say care and support, or if I'm a doctor, I might say assessment and treatment for a discharge. Do we all agree?
No.
Yeah.
Someone said
Not
no.
always, not always.
Not always.
Especially if it's discharge, mainly home visits, which we normally forget to add.
Okay, so, but isn't it care and support? Isn't that why you go to the home, to provide care and support?
Mm-hmm. Yes.
I'm talking about the introduction, right? You can say home visits later. Okay.
Care and assistant.
It might be care and assistance, which is similar meaning, right? But these are the two most common for discharge. That's all I'm saying, okay? Not that you must always do it. They're just most usual. The transfer, though, you wouldn't say that, would you? What would you say for a transfer?
Ongoing care.
Ongoing care.
It's always ongoing care and support, right? Or ongoing treat. It's that word ongoing or continued.
Continued.
If you're writing to a GP, though, would you say care and support? No. Right? So you might say continued treatment and management. Yeah, continued whatever.
Care.
But the key things are those words here. I'll just take it like that, right? Continued, ongoing. What about referral to a specialist?
Further management or diagnosis.
It's usually assessment. Yeah.
Assessment and management, and sometimes like it mentions something in like for MRI or if anything it mentioned in the case note.
Yeah.
The request, but
we cannot. I think with the thing that Sabrina said, we cannot that as the request paragraph and not as a part of the intro.
Yeah. Right. You want to try and keep it simple. Okay.
The diagnosis.
Yeah. Okay. So this is how I think of sentence 2. You divide it in 2 parts. Firstly, tell me what type of letter it is. He's being transferred today. He's being referred to you. He's being discharged today. Okay. Then tell me the purpose. Most important part of your intro, right? And he now requires, and those next words can affect your grade massively. Okay. Come on. If you write to someone and say, and he now requires further treatment, but he doesn't require treatment, is that good? That's really bad.
Yeah.
Okay. So just watch out for that. Let's do some practice. Okay.
Alan?
Yes.
I have a question. How about for urgent cases?
Yeah, this is a good variation. Let me put it in. So if it's urgent, we want to say something like
urgently requires.
Yeah, and now urgently requires, maybe?
And now
there's many different ways.
Urgently requires.
Immediate.
You're immediate. Yeah, you're immediate.
As soon as possible, maybe.
You could say that. Well, it's a little bit informal.
It's not formal, I think.
As soon as possible is a bit weird for something that's urgent. Like, if you're not very busy, would you mind treating this dying man? It sounds a bit weird. As soon as possible. Yeah. You can be a bit more forceful, though, with your language when it's urgent. So yeah, obviously urgent's a key thing here. Just put the word urgent in some way like this. And now urgently requires. Okay. So again, I'm going to show you something quite easy. You've got 30 seconds, guys, to think of the sentence. And again, I'm just going to call out a name and you can tell me the sentence, but you can also type in the chat box what you think you need. Okay. So 30 seconds, write me sentence 2. It's the same one. Okay. So where do we look? Where do we get the details to write our sentence 2?
Writing task.
Usually here. Can everyone see this? Shall I zoom in a little bit? Are we okay?
We're okay.
Okay. 30 seconds. Find the letter type, find the purpose. I'll ask a random person. Find the letter type, find the purpose. Okay, I think that's long enough, isn't it? That was only 25. If I say Karen, are you there, Karen?
Yes, Alan.
Can you tell me that? What would you say? He now?
He is due to be. I'm sorry.
Yeah, sorry. No, it's my fault. He is due to be
discharged and now requires further care and support.
Now requires. I do like your, but it's not necessary. Okay, so
yeah,
discharged and now requires further care and support. Easy, right? Can you give me the full, who wants to give me the full introduction? Right, we've got the name, we've got the where, we've got the why, pneumonia, we've got this. Let me ask Daniela, give me the full intro.
Okay, so I'm writing regarding Mr. Ramamurthy, who was admitted to our hospital for total hip replacement.
Great, good.
Full stop.
Not a total hip replacement.
I know this is a different guy. Sorry. Who was admitted our hospital due to pneumonia.
Good.
He's ready to be discharged today and now requires further management or could be ongoing care.
Ooh, now what do we think is required here, guys? Can anyone see? Maybe it's not in this.
Yes, I think he wouldn't be discharged today. He will be discharged tomorrow.
But usually we're looking here, aren't we, for word like
yeah, for word. It's like back to the retirement home.
Maybe.
Okay.
Further care and support.
So if the information is not there, what do I need to do if I'm not sure what the purpose is? Where do I read?
The person.
The first part.
Right.
Read the letter. Read the discharge plan. Yeah, and focus on the discharge plan. Okay. Who else wants to give me one more? Let's say this is care and support, and let me just say, Han, can you just give me both sentences, please?
Yeah, but can I use the different version?
No,
I have.
That's coming next. Yeah, if it's okay, just because it's an intro class. Go on.
Okay. I'm writing regarding Mr. Ramamurthy, who was admitted to our hospital due to pneumonia.
Good.
He will be discharged today. Good. And requires your further care and assistance.
Good. And support and assistance, they're good synonyms. Let me just test this with Mariam. Can you just do the same thing, Mariam, here? I know it's quite easy.
I'm writing regarding Mr. Ramamurthy, who was admitted to our hospital.
Good.
For, due to is it?
Yeah. Due to.
Yeah. Due to pneumonia.
Good.
And now, full stop. He requires your.
He now requires.
No, he is being. Sorry, he is being referred. Oh, yeah. Like he's being discharged to you, and now he requires your care and support.
Good. Okay. So it's fairly formulaic, but this is the sort of the beginning of building the intros. Can I show you one more, guys? And you've got to find all the information. Okay.
Please.
Yes. Here we go. One more. It's actually the same one again, okay? But you now have 15 seconds. You have all the information here to write your introduction. 15 seconds starting now. Just write it down or type it in the chat box. I can see that there's some nice ones from Daniela and Sailesh and Rekha from before. Looking good for Mr. Baker. I'll try to review those later. All right, that was 15 seconds. Let's look at my list of names. We'll just have a random person. This is good. I think I've asked most people. Rekha?
Yes, sir.
Sorry, I'm getting your name wrong. I'll get used to it. Can you say the full thing?
I think I'm writing regarding Mr. Baker, who underwent for a total...
tell me where first, according to this pattern.
I'm writing regarding Mr. Baker, who underwent a total hip replacement in our hospital.
Okay, you can swap it round if you want. That's fine. Sentence 2.
Okay. He is scheduled to be discharged.
Yeah, discharged. Let's say today.
Today, I don't know.
Yeah.
And requires continued care at your nursing home.
Good. It is a discharge letter. Sorry, I should have made that clear. It is discharge. I like the way you didn't use he is due to be.
Okay.
What did you say? It was good. He is.
He is scheduled to be.
Scheduled to be. I like that one.
To be discharged.
It's less repetitive, isn't it, guys? If you say due to pneumonia here, right? Due to pneumonia.
Yeah.
Or due to whatever, blah, blah, blah. And then you say he is due to be here in the same introduction. It's a little bit repetitive, isn't it?
Ready.
Due to 2 times. So instead you can put scheduled to be.
Or set to be.
Or ready to be.
Ready to be is also good as well. Ready to be, scheduled to be. What else can we say?
Set to be.
Will be discharged.
You could say will be as well. He's ready to be, he's scheduled to be, he will be.
Set to be.
He is set to be. Ooh, I like that. Is that Mukit? He's set to be. That's slightly informal. I'm not 100% sure of that. Also,
He's being discharged or he's being
yeah, you can use the present tense with a continuous. Good. Good, good, good. Okay. So let's go back to this again. We have these 2 sentences, right? You give me the who, you give me the where, you give me the why. That's sentence 1. Sentence 2, try to give the letter type. He's being transferred today. He is being discharged today, right? And then give me the purpose of the letter. Care and support, assessment, management, treatment, evaluation, investigation, all these things. Take your purpose from the what?
Case notes. The writing
You
task.
must take it from the case notes, because otherwise it's not, you're just making it up, okay? Now, just to end this class, I've got some exercises for you, okay? Got 1 discharge, 1 referral, 1 transfer. You can type them in the chat box or you can write them down on a piece of paper. Here are my words. It's quite easy, isn't it? Write them down. You've got 2 or 3 minutes, okay? So the exercise is to write 3 introduction paragraphs. Off you go. Okay, we've got some coming through already. That's good. Don't rush though, guys. Plenty to be getting on with. Let's have a look here. So Salish has done number 1. Writing out Mr. Green, who's admitted to a hospital due to a heart attack. He's scheduled to be discharged today and requires your ongoing care and support. Excellent, Salish. That's good. Keep them coming. Daniela says, I'm writing regarding Mr. Green, who was admitted to a hospital due to a heart attack. He's scheduled today. He's being discharged today. Okay. And now requires your continued care and support. Spelling of requires, Daniela, just a small thing.
Oh, yeah. It's like,
okay. Keep going, guys. Don't let us put you off. Just write it down on paper if you want. That looks good, Alexandra. The first one's quite easy, isn't it? Second, Eugenia. I like the fact you've got a party in there. Good cause, Eugenia. And requires now, Eugenia. And requires now. Sailesh has got a nice original one here, and I'm happy to have a look at those, Sailesh. Thank you for seeing Mr. Jones, who presented to my clinic with clinical features suggestive of pneumonia, for which she requires further assessment treatment. Okay, I'll put that on the board. Nice one sentence variation there. Chauvin says, I'm writing regarding Mr. Green, who admitted to hospital due to a heart attack. Chauvin, nice to see you in class.
Yes, no sir, heart attack.
Yeah, so countable, so, and it's general. So a heart attack following a party. Yeah, he's going to be discharged today and requires your further care and support. Seems good to me. Danielle, I'm writing to refer Mrs. Jones, who was symptoms suggestive of insomnia and now requires further assessment and treatment. Okay, that's good. Put some of these on the board. We got some for Mr. Hope. Right, regarding Mr. Hope, who's admitted to a hospital due to broken arms following a motorcycle accident. He's ready to be transferred today, now requires your ongoing care and support. Very good, Daniela. Spelling again, though. Susmita, I'm writing regarding Mr. Green, who was admitted to a hospital due to a heart attack. He's being discharged today, however, he needs further care and support. That's interesting with however, Susmita. I don't think I mind that. Alexandra says, I'm writing regarding Mr. Hope, who presented to, who's ER, Alexandra? Who's?
Emergency department.
But you can say our, it's usually our when the person writing is from in the hospital, right? So our ER due to broken arms, due to two broken arms. Okay, some great stuff here. I'm sorry I can't review it all. I'll just do this last one from Marianne, and then we'll start. Okay, so I'll stick this here. Okay, I'm stopping the screen. We're going to have to end the class soon. I'm just going to review these 3 sentence types. Then I'll give you some homework. This is extra homework from me, which I'm happy to do for you guys. Okay, so let's just quickly go through these 3. And then I'll tell you what the homework is. Okay, so number 1, this is what someone posted here. What do we need here, everyone?
Capital.
Capital.
Need capital I. I'm sure that person knows that, and it's just on the phone or something. So I'm writing regarding Mr. Green, who was admitted to hospital due to, what's the?
Article.
Just do you know what a hearth is? Does anyone know what a hearth is?
No.
It's like an old-fashioned term for a fireplace.
Uh-oh.
So attacked by a fireplace. That's surreal. So hospital due to a heart attack. He is. What do we need here, guys? Schedule.
Scheduled.
To be discharged.
Discharged.
And now.
Requires.
Where's
your? Could be your, but it's not necessary.
Yeah. Here's another one. I'm writing regarding Mr. Green, capital G, who's admitted to a hospital due to, what do we need again, guys? A heart attack. He is being discharged.
D.
Today.
Discharge.
But don't forget the D, people who are new. What about this? However, he needs further care and support.
You are not contrasting.
It's not a contrast.
See, the thing is in teaching, right? You have your way of doing it, don't you? And you've got to be very careful not to say no to someone when actually it's just, we're not used to that idea. Is it a contrast? Well, if he's being discharged, normally you think that someone is better.
Yeah.
There's kind of a contrast. So I'm not going to say that person is wrong. The examiner could not say you were wrong, but you would need to have a comma here. If you use however in the middle of a sentence, you need 2 commas, okay? So that's an interesting variation. Variations are okay, I don't mind, just so long as you don't make mistakes, Okay, number 2. I'm going to read it to you guys and you tell me, this is one of yours, you tell me what you think. I'm writing to refer Mrs. Jones, who has symptoms suggestive of insomnia and now requires your further assessment and treatment. Ooh.
Yeah.
What do we think? It's nice, right?
Yeah.
Yeah.
So this is a nice variation. I'll put this under this variation here, sorry. And Sailesh,
where is to my clinic. Okay.
Yeah, there isn't. So they've omitted some detail, and I don't want to. Again, I don't want to say that my way is the only way. That's that. As long as it's clear, that's fine. Sailesh, you've got this really nice one here. Could you read this to us? This is nice for doctors.
Thank you for seeing Mrs. Jones, who presented to my clinic with clinical features suggestive of pneumonia, for which she requires further assessment and treatment.
Yeah, and this is being used by a lot of people at the moment. It must be in some of the forums. I think that's nice. So yeah, another nice variation if you want to try and copy that. That's cool. Obviously, a more normal one would be, I am writing regarding Daniela, Mrs. Jones. Can you help me with this, Daniela?
Who I would say.
What's the verb we need?
Who has symptoms suggestive of.
But we can do that, but let's do my way. So we need to say where. So who visited, right?
Who visited
our clinic.
Who has been attending our clinic with.
For what?
For checkup.
It could be for a checkup, yeah, for a checkup.
For a checkup because it's something planned. For a checkup.
Following. We would say this is difficult. A period.
Yeah.
Period
it's
of
more
insomnia.
difficult.
Yeah. Insomnia. Okay. He. What should we say, guys? He is being
referred to you.
You.
And now requires.
She. No.
To you. Is it she? Sorry, you're right. She.
It's a she.
Being
Yes.
referred to you. And now requires.
And now requires your assessment and treatment.
Your assessment and treatment. How are we doing for time? I really am running over here. Do one last one and I'll quickly give you the homework. So this is something that someone wrote. I'll read it to you. I'm writing regarding Mr. Hope. Little tip, guys. This is This is not necessary anymore. The dot. You can put it if you want, but in modern letters we don't bother. We're too busy. So I'm writing regarding Mr. Hope, who was admitted to our emergency department. What do I need here, guys?
Capital.
Capital.
Anyone know why? Why do I need?
Yes,
because it's a
part of hospital.
The name of
it's the name of a department. Usually it's called the emergency department. Okay. Due to broken arms. Now, many of you are saying broken arms. That's okay, but in English, what would we say here?
His.
Now, usually the rule, isn't it, when you talk about body parts, is you say his or her, don't you?
Yeah.
But not in this situation. This is an exception. I would put 2 broken arms. I don't know why. Plural. Okay, that's an exception. Usually talking about body parts, his arm, her leg, his head. Yeah, but not in this case. Following, he's being transferred. Transferred to you and requires ongoing.
Comma before following.
Yeah, well, these are optional commas. This is an optional comma, but you're right. I always put comma here, but it's optional. You don't necessarily need it, but there are 2 clauses, so I like the comma there. He's been transferred to you and requires ongoing care and support. If you're going to do my thing here, I think we should say something here. What do we need here? More detail.
Today or today?
Try to say when. Yeah, I think that's not too much detail for an introduction, is it? Right? Tell the reader if it's today, if it's tomorrow, right? Or next week. If you have that information, try to get it into the case notes. Okay, so thank you very much everyone for attending this class. Okay, we've seen 3 different types. We've seen lots of variations in introductions. And my homework is this.